Your knees are trying to tell you something right now. And in the next 5 minutes, literally 5 minutes, you're going to feel a difference that most people spend months chasing in physical therapy. This isn't another generic stretch routine. This is a specific protocol built on isometric contraction science, the same method elite athletes use to rebuild joint strength without a single painful movement. And here's the promise. By the end of this video, your knees won't just hurt less. You'll actually understand why they hurt. And that knowledge alone will change everything. I've spent years studying joint rehabilitation and pain mechanics. I've worked through this protocol with people in their 30s, their 60s, even their 80s. People who were told surgery was their only option. People who could barely walk down a flight of stairs. Here's what makes this video different from every other knee pain video you've seen. Most of them focus on stretching. Stretching feels good in the moment, but it does almost nothing to stabilize the joint. What your knee actually needs is tension. Controlled, intentional tension. That's exactly what isometrics deliver. Here's what we're doing today. I'm going to walk you through 3 levels. Level 1 removes the immediate pain signal. Level 2 activates the muscles that have gone completely dormant around your knee. Level 3 locks in the stability so the pain doesn't come crawling back tomorrow morning. We'll cover all 3 in 5 minutes flat. And stay with me until the 3rd level, because what happens in that final exercise is something almost nobody talks about, and it's the real reason your knee keeps getting worse, even when you rest it. Picture this. You wake up, you swing your legs off the bed. That first step hits you like a warning shot. Sharp, dull, aching. Doesn't matter which kind. Your brain is already bracing. Your whole morning shifts. You move slower. You skip the stairs. You sit back down before you meant to. That image is familiar. I know it is. And here's what nobody tells you. Resting more is actually making it worse. Every day you avoid loading that joint, the supporting muscles get weaker. The joint gets less stable, and the pain cycle tightens its grip. So if you've tried rest and it hasn't worked, good. That means you're ready for what actually works. Even if you're starting from 0, even if your knees have been a problem for years, even if you've already tried other routines and felt 0 improvement. This is where it changes. The first level is about one thing only, telling your nervous system to calm down. When your knee hurts, your brain sends out a pain signal. That signal tightens everything around the joint. The muscles brace, the circulation drops, and the pain feeds itself. It's a loop. Isometrics break that loop fast. Sit in a chair with both feet flat on the floor. Now press your right heel down into the floor like you're trying to push it through the ground. Don't move your leg, just press. Hard. Hold that tension for 30 seconds. Feel that? That low hum of muscle activation around the kneecap. That's your quad firing. And when the quad fires under controlled tension, the pain signal at the knee joint drops almost immediately. Studies in isometric rehabilitation consistently show pain reduction within 45 seconds of sustained contraction. Not 45 minutes, 45 seconds. Switch legs, press down, hold for 30 seconds. Do both legs twice before moving on. Your patellar tendon, the one right below your kneecap, responds to load. Give it the right load and it stops screaming. That's the science. Simple, but most people never use it. This is where most knee pain routines fail completely. They strengthen the quad. They ignore everything else. The muscles on the inside of your thigh and around your hip directly control how much pressure lands on your kneecap with every step you take. If those muscles are weak, and in almost every chronic knee pain case they are, your knee is taking damage every single time you walk. Stand with your back against a wall. Slide down until your thighs are parallel to the floor, or as close as you can get without pain. Now squeeze your inner thighs together like you're holding a piece of paper between your knees. Don't let it drop. Hold for 45 seconds. Don't think about the discomfort in your thighs right now. Think about what's happening at your knee. You're loading the joint in perfect alignment. You're forcing the VMO, the teardrop-shaped muscle just above and inside your kneecap, to fire and hold. That muscle is the single biggest protector of your knee joint. And in most people with knee pain, it has gone almost completely offline. 45 seconds. Rest 20 seconds. Do it again. Now stand sideways next to a wall. Lift your outer leg slightly, just a few inches off the ground. Press the side of your foot gently into the wall and hold. Don't move. Just press outward and hold for 30 seconds. Switch sides. This one activates your glute medius. Most people have never heard of it, but it controls the side-to-side movement of your knee every time you take a step. A weak glute medius means your knee collapses inward slightly with every single stride. Multiply that by a few thousand steps a day. That's what's been grinding your knee down. You just turned it back on. Here it is, the part that most people never reach, and the reason your knee keeps hurting, even after a good day, even after rest, even after the pain seems to go away. The problem isn't just muscle weakness, it's neuromuscular communication. Your brain and your knee are not talking to each other properly. The neural pathways that control fine joint stabilization have gone quiet. And when those pathways are quiet, every uneven surface, every sudden movement, every small slip, your knee absorbs all of it with zero warning. This exercise fixes that. Place a rolled towel or small pillow under your right knee so it's slightly elevated, about 2 to 3 inches. Now push the back of your knee down into the towel as hard as you can. Fully straighten the leg. Hold that locked out position for 45 seconds. What you're doing right now is firing the final few degrees of quad activation, the range that is almost always lost in knee pain patients. Physical therapists call this terminal extension. It's the position where the knee locks, stabilizes, and prepares to bear full weight safely. Hold it. Don't let it go. Switch. Left knee. Towel under it. Press down. Fully extend. Hold 45 seconds. Rest for 30 seconds. Do that sequence 3 times total. And here's what happens next. Not in 6 weeks. In the next 24 hours, you'll notice something. That initial warning shot when you stand up in the morning, it'll be quieter. Your first few steps will feel more controlled. Less bracing, less guarding. That's not coincidence. That's your neuromuscular system coming back online. Here's your 5-minute protocol. Every single day or at minimum 5 days a week. Level 1. Seated quad press. 2 rounds, 30 seconds each leg. Level 2. Wall sit with inner thigh squeeze, then hip abduction hold against the wall. 2 rounds each. Level 3. Terminal knee extension with the towel. 3 rounds, 45 seconds each side. Total time, 5 minutes. No equipment needed except a chair and a towel you already own. The most common mistake people make after doing this once and feeling better is stopping. Don't stop. The first session reduces pain. The first 2 weeks rebuild the foundation. The first month changes the structure around your joint in a way that lasts. Your knee didn't get weak overnight, but the good news is that isometric training responds faster than almost any other form of exercise. You are not too far gone. You are not too old. You are not past the point of change. You just needed the right 5 minutes. Start today, not tomorrow. The towel is right there. The chair is right there. Your knees have been waiting long enough.